Hello, I am Dr. Monu Singh, Director and Senior Consultant, Department of Orthopaedics, Narayana Superspeciality Hospital, Gurugram. Today, friends, I would be talking about pain relief in patients with knee and shoulder pains who are having disabling pain and loss of function in their shoulder and knee joints. We have a pain relieving modality which is at the cutting edge of technology, which goes by the name of radio frequency ablation, and this is a technique which I am going to talk about. Now, this technique, before I start with what exactly this technique is, let me tell you what are the kind of patients who are benefited by this technique. We come across so frequently in patients who are having disabling shoulder pain, frozen shoulders. We come across patients who are diabetic, hypothyroid, or even otherwise having pain and stiffness in the shoulder, who are so debilitated that they are not able to undergo any kind of useful physiotherapy. A lot of medication is given to these patients, but they are not able to tolerate that chronic continued mode of medication, which sometimes results in complications of gastritis and other major involvement of the gastric mucosa, of the liver, of the kidneys. So it is preferable not to give analgesics for a long duration in these patients, but to look for different avenues of treatment. Also, we come across patients with very chronic and disabling pain in the knee joints. This may be in patients with arthritis who are not able to undergo a knee replacement surgery. This may even be in patients who have undergone a knee replacement surgery but are troubled by some amount of pain which is residual. So these are two different scenarios which are present at the end of a spectrum of different pathologies where the common factor is pain in the knee joint. Now, once again, if the patient is not willing to get any major intervention done or is not fit for it, then we have to find different ways and means of providing pain relief in such patients. In these patients now, we have a very exciting new modality for giving pain relief, which goes by the name of radio frequency ablation of the sensory nerves. So what basically it means is that the nerves which are providing sensation to these specific joints, the sensory branches of these nerves are disabled or paralyzed for a appreciable duration of time by giving a radio frequency stimulation or ablation. So this technique does not involve any kind of incision. It's a purely percutaneous technique. It is this treatment is given out in the OPD or preferably under some amount of short anesthesia. We prefer to do it in the clean operative room setting in daycare, where a little amount of local anesthesia is required, and we are able to position our needles in the presence of the C-arm, which is a continuous X-ray monitor, whereby we can place it very precisely. What we do is we place these electrodes in the vicinity of the sensory nerves, and through a specific software we pass pulses of radio frequency through the tip of those needles, which are being cooled at the same time. So a certain amount of energy is emitted, which is in a very localized region. This energy, what it tends to do is paralyze those sensory branches, and eventually once those branches are paralyzed, the patient starts getting pain relief in about 2 to 3 weeks time. Now, this pain relief is excellent. Most of the patient, it is more than 50% pain relief. Sometimes it is much more, and it stays there for about 6 months to 2 years duration. This is because after a certain duration, the nerves, they tend to regenerate, but it also means that the patient is pain-free for that duration, and this whole thing can once again be redone. So I feel this therapy, radio frequency ablation of the genicular of the sensory nerves, is an exciting new technology which we can offer to our patients who are not willing to undergo any kind of surgery, or they are not fit enough by means of anesthesia to undergo these surgeries, and we are able to provide them with excellent pain relief without any major expenditure and without giving any kind of incision, and that too in a daycare setting. So I think it's an exciting technology that we can make use of. Thank you.